I moved here almost 14 years ago. I started up our colonoscopy program and have been doing them here since that time. I do hundreds a year and then thousands in a lifetime. So this is something we do routinely. I feel very proud that we can offer this service here in Leavenworth. As far as the procedure itself, we're standing in our procedure room. Before you arrive here, you have to get cleaned out. For many folks, that's the hardest part of the procedure. Once you're cleaned out, you arrive here about an hour before the procedure starts, and I'll let Deb talk a little bit about what she does here before I arrive in the room.
Well, I have a big responsibility for pre and post procedural education, so that's first and foremost with me. The patient's well informed and they feel safe and comfortable during the procedure. So they learn about the procedure before we start, and then we help them get into a gown and get comfortable here on the procedure table and insert an IV. During the procedure, I'm monitoring the patient carefully, their vital signs, their blood pressure, their heart rate, CO2 monitoring, and administering the sedation and pain medication that's called conscious sedation or procedural sedation, fentanyl and Versed. And those are used to keep the patient comfortable, and it also serves as a sedative and amnesiac. The patient might experience, it's more of like a sleepiness, I try to explain to them, almost like a twilight sleep. They are not under deep sedation. If I ask them to take a deep breath or just call their name, they will wake up. There may be some minor cramping discomfort at times during the procedure as the scope is moving through the bowel, but for the most part there is no pain. The patient is recovered right here in the room, and we go over discharge teaching again before they go, and make sure they're nice and comfortable before they go home, and they can return to their usual activities the next day or within 24 hours.
So at the end of the day, it's important to us that we offer this very important service here locally in a way that's convenient, but also safe and professional and personal. We want our patients to feel like they're getting the best possible service, and of course, we're always open to feedback. And if you have any questions, please contact me or your regular provider at Cascade Medical.